Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Tourism for inclusive growth. This year's theme of the United Nations World Tourism Organization calls for growth and recovery following the devastating impact of COVID-19. And civil society groups protest Edo government's decision to make vaccination a requirement for entry into government facilities. And New South Wales, home to Sydney, announces its roadmap out of lockdown. According to the United Nations, the biggest crisis in the history of tourism continues into a second year. Between January and May 2021, international tourist arrivals were 85% below 2019 levels, or a 65% drop in 2020. Despite a small uptick in May, the emergence of COVID-19 variants and the continued imposition of restrictions are weighing on the recovery of international travel, while domestic tourism continues to rebound in many parts of the world. The UNWTO says the impact of the COVID-19 pandemic on tourism could result in a more than $4 trillion loss to the global economy, and tourism experts do not expect a return to pre-COVID arrival levels until 2023 or later. Meanwhile, developing countries have borne the biggest brunt of the pandemic's impact on tourism due to the absence of widespread COVID-19 vaccinations, suffering the largest reductions in tourist arrivals last year, estimated at between 60% and 80%. Well, on this World Tourism Day, the call is that the pandemic represents an opportunity to rethink the future of the tourism sector, an area with the unique ability to make sure no one is left behind, as recognized by the second principle of the 2030 Agenda for Sustainable Development. And in the meantime, over 71 million COVID-19 tests have been conducted on the African continent, which has confirmed more than 8 million deaths and over 209,000. Here's a look at the virus update.
255 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 5 states and the FCT, an increase from the figures reported earlier. Imo had the highest number of infections with 124 cases. 72 cases were recorded in Lagos. 36 cases were recorded in the FCT. Rivers had 16. While Enugu and Kano states reported single-digit infections of 6 and 1 samples respectively. There were 0 cases reported from Bauchi, Benue, Nasarawa, Osun and Sokoto states, and a backlog of 124 confirmed cases and 140 discharges from Imo State for the 20th till the 26th of September. The overall count of confirmed cases in Nigeria now stands at 204,456. 199 people have been discharged in the last 24 hours, increasing the total number of recoveries to 192,620. With more than 3,000 cases, Lagos accounts for the state with the highest number of cases currently on admission, followed by the FCT, Delta, Edo and Oyo states. 4 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,677. Presently, there are more than 9,000 active cases in Nigeria, while over 2.9 million samples have been tested so far. Over 4.6 million eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.8 million persons have been fully vaccinated so far. In Africa, there are more than 8.2 million confirmed cases and over 209,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 231 million, while deaths are now more than 4.7 million.
And the private sector remains an untapped resource to addressing longer-term challenges in Nigeria's health security. This is according to the NCDC Director General over the weekend at a meeting with stakeholders, where he further adds that the national response to the pandemic has been a whole-of-society effort, with public and private sectors working together to strengthen the response in different critical areas. The COVID-19 pandemic has undoubtedly struck the best health systems, leaving governments perplexed on how to address the health threat. However, since 2020 in Nigeria, as with many other countries, a holistic approach involving all stakeholders in communities has been a key factor combating the virus.
From a disease that no one knew about 2 years ago, there are very few other things since the beginning of mankind that have killed so many people in such a time. None of the wars, none of the big world wars we talk about have led to so many deaths. So this is really an incredible challenge to humanity. Nigerians have really come together, worked together across government, federal and state, across agencies to deliver a response. And that is how a lot of these collaborations have been sustained, built and sustained, because none of this can be done by one organization. All we can do is say, listen, these are mandates, these are the resources, we will leverage on it and work with yourselves to deliver.
The Nigerian Communications Commission recognizes the crucial role private organizations, especially telecommunication companies, have to play in helping health systems and communities build and sustain resilience before, during and after disease outbreaks.
Technology is the best approach to tackle issues. And I think in Nigeria, we are fortunate to have very, very responsible operating companies who are ready to support initiatives of government under the leadership of the NCC as a regulator. We will at all times, I assure you, going to mobilize them and do more.
The NCDC appreciates the support of the private sector in amplifying the key messages to the public on the guidelines for COVID-19, which provided the agency the opportunity to promptly reach millions of Nigerians with life-saving information.
When we started, we had a 10-digit toll number, right? And every time I had to share this number on TV or live TV, you know, you'd make a mistake with one digit or the other. And Nigerians also, I realized, had difficulty remembering this. So we started working with NCDC. They were very kind. It really demonstrates working together within government, got a new toll-free 6232, which is now in everyone's lips in Nigeria. So this is really great credit to the incredible telcos we have in Nigeria and the NCC working together with NCDC to support the response to this incredible pandemic of our life.
While thanking key partners in the fight against COVID-19, rebuilding stronger health systems will go a long way in preparing Nigeria for the new normal. And some civil society groups in Edo State are frowning at the state government's no vaccination, no entry policy into all government facilities, as they maintain that taking the jab should be voluntary and should not be under duress. The protesters who marched through some major streets to the State Civil Service Secretariat in Benin City, the Edo State capital, say that state government should focus more on other plaguing issues like insecurity.
Checkpoints mounted at the government premises as the Edo State government enforces mandatory COVID-19 vaccination for its workers as well as visitors. Weeks after there is an objection against this government policy on COVID-19 vaccination, these protesters make their grievances public. The march takes them to the seat of public service in the state. Their frustration is loud. They insist that no one should be subjected to compulsory COVID-19 vaccination.
My body is my right. It's my right. I have that right to decide whether to take the vaccine or not. Take it. A situation whereby the governor is forcing Edo people, is coercing Edo people to take vaccine, we shall resist Governor Godwin Obaseki in all ramifications. He cannot force us to take vaccine. It is so sad that workers cannot even access secretariats, their offices.
Coming out from the daily COVID-19 meeting with Governor Godwin Obaseki is the head risk communication pillar of the COVID-19 response team, Crusoe Osagi. He says the protest will not deter government from performing its obligations. Protecting the people remains sacrosanct.
No one is being forced to take the vaccines. However, everyone who has decided to take the vaccine, we owe them a responsibility of protecting them. And so that's why we're saying, you know what, as far as we're concerned, for government institutions, if you don't have proof of vaccination, you cannot access the offices. You can explore other means of working, work from home, other remote ways of working. We'll be fine.
The Edo State government has again reiterated that COVID-19 vaccination has not been made compulsory, but it expects residents to support the fight against the virus.
And to the southwest, where the fight against COVID-19 in Oyo State appears encouraging as fewer patients are currently on admission at the isolation center. The chairman, Task Force on COVID-19 in the state, Professor Temitope Alonge, said that all the strategies deployed since the third wave began has yielded fruits, as only 18 people are currently on admission at the main isolation center at Oludo Ibadan. He said decontamination of inactive isolation centers are ongoing across the state at the moment, since there are no patients in them. He added that the government will not rest but intensify efforts to achieve a healthy state. Well, joining us for more on the latest happening there is Dr. Muideen Olatunji, Executive Secretary, Oyo State Primary Health Care Board. He joins us now virtually. Thank you for joining us on the program.
Thank you for having me. Good evening.
Good evening. What's your overall assessment of the vaccination rollout thus far in the state?
Thank you. So far, so good. In Oyo State, the vaccination exercise has been so smooth. Initially, when we started during the first phase, the only time you had a kind of slow acceptance. But from the second phase, the acceptance and the way people come for the uptake has been so commendable. Like in the first phase, for us to reach the target of about 6,000 individuals that are vaccinated, it took us about 3 months. But this time around, within 2 weeks, we've been able to go beyond the 60,000 target that we actually set out to do at the initial onset. So that shows the acceptance is so high, and the rate of coming for the uptake has been so commendable in the state so far.
So a lot more awareness, a lot more sensitization. But tell us, is there a vaccine mandate in Oyo State? I mean, what do you think about what states like Edo or Osun states and a few others are perhaps thinking about doing on vaccine mandate?
Well, the only mandate in Oyo State as far as vaccination is concerned is the position of the state government that tends to encourage everybody to be able to go forward and uptake the vaccination for their own safety and to follow all normal protocol that has been listed for the preventive measures. But like you mentioned, that of Edo to say that people should not come for certain things because they've not been vaccinated. That has not been the policy of Oyo State. And my own issue about that is this: is a good way to make people take up vaccination. At least your right stop while my own starts as a public health measure. But the only drag in it is this: how much vaccine we have in the country put together. If you look at what we received for the first phase and the second phase put together, it's less than 10 million. And the population of the country is beyond 200 million, going with 2006 census estimate that we have. Now, if you now say everybody should not come out until they take the vaccine, and I think it doesn't really add up. We need to make provision before prohibition. So we need to ramp up the amount of vaccine that we have in the country before we can start compelling people that by force must do this. Don't do this one, you lose certain privileges. I think there's a gap a little bit as far as that is concerned.
All right, Dr. Muideen, finally, to get your thoughts, and this is if someone is undecided whether to take the vaccine or not, what advice would you be giving to that person, briefly?
Only advice, and honest one I'll give such a person is that they should value their own life. Undecisiveness is not something to do at this point in time. Like I was cracking joke with some people when the first phase rollout started, the governor was the first person to take it in our state. And I was talking to others that were having hesitancy, that you are expecting the governor either to drop dead or to grow on or to have tail. Now, it's more than 5 months. He has not grown on, he has not developed tail. Neither do I and every other person in the state. So all this mischief and disinformation, people should disregard it. All this conspiracy theory will not take us anywhere. And statistics is there for us to see. People that actually take the vaccine, even if, mark my word, if they come down with infection on the long run, the fatality cannot be compared with somebody that does not take the vaccine. And no leader of in any part of the world will come willingly and do something for a citizen that will harm them. We should be able to trust the country and all experts put together that if they believe this is not fit for us, they will not ask us to come and take it. Their integrity is on the line, our honor is on the line, and we put all these things for every person to say, come forward and take this vaccination. Anybody now be having hesitant, for me, it's quite unfortunate, and I think everybody should come forward and take the vaccine.
I'd like to thank you. Dr. Muhyiddin Olatunji is the Executive Secretary of your State Primary Healthcare Board. Thank you for joining us on the program.
Thank you for having me.
Still to come on the program, pharmacists raise awareness on trust as key to effective healthcare delivery. Please stay with us. With societies in a time of general distrust fueled by COVID-19 pandemic and the infodemic around it, pharmacists are raising awareness on trust as key to effective healthcare delivery. Marking the World Pharmacists Day, 25th of September, the Kano State Chapter of Pharmaceutical Association of Nigeria called on all sectors of healthcare delivery to ensure that the key ingredient of trust is included for strong collaboration. They're saying if the sector must be effective, especially at this time. Chairman of the Faculty of Clinical Pharmacy, West African Postgraduate College of Pharmacists, further used the opportunity to debunk controversies surrounding the COVID-19 vaccination.
Science is dynamic. What you were doing some 15 years, you cannot do it in 5 months, you cannot do it in 5 weeks. It's all about materials. I could remember in those days, ordinary computation of results, sometimes we take 6 months to interpret a result mathematically. But now we have computer that we use some softwares and they give us results in 2 seconds. If it is so, drug discovery can equally be reduced to that. However, I blame some scientists and some industries. They concentrated more in the profit making than the humanitarian aspect. So when they talked about this vaccine, drugs that are coming in, companies were so much in a hurry to have a grasp of the financial or the profit component instead of looking at the humanistic part of it. So there seemed to be a head-on collision between politicians and scientists. There seemed to be a head-on collision between the health professionals. And unfortunately too, Corona is mutating, Corona changes. Today you get information from this physician, tomorrow you get that. Most worrisome, politics overwhelmed it.
Away from Nigeria, the government of Kenya has banned Mashujaa Day, otherwise known as Heroes Day celebrations in all counties due to the COVID-19 pandemic. Interior Principal Secretary said that the public should watch the national celebration in Kirinyaga County on live television. The event will take place at Wanguru Stadium in Mwea constituency. It said that the celebrations will not be held in other counties because cases of the disease are still being reported. They're stressing that the government wants to protect Kenyans, and they've asked county commissioners to ensure that the ban is enforced. Well, joining us from Nairobi, Kenya is Dr. Lucky Mwangi, and he is a general practitioner, joins us virtually. Thank you for joining us on the program. First, what is Mashujaa Day, and what does it mean to Kenyans? What are some of the containment measures that will be observed in the run-up to that day?
Okay, thank you for having me on your show. So Mashujaa Day is, Mashujaa is heroes in Swahili. So it's a day where we honor our heroes. These are the independence heroes, the guys who fought for independence. It's on 20th of October. So basically that's what Mashujaa Day is. It's like Independence Day, only that we are honoring the heroes. So as you've said, we are not going to be celebrating this holiday all over the counties. Normally what we usually do is we have the main event at the National Stadium, and we have the minor events at the counties. What you guys would have like a national event and one at the state levels. So for this one, we're not going to be having Mashujaa Day celebrations in the state levels, what we call counties. And the stadium will be only hosting 2,000 individuals as opposed to full capacity for social distancing and all that.
So Dr. Mwange, in terms of, this announcement, what are citizens' reaction? Are they disappointed, or do they all think that this is in order?
Of course, everyone must be disappointed because such a celebration is a huge thing. One, when the state visits your hometown, things usually happen. Roads, everything is streamlined, at least to have this event to be perfect. So things like businesses, we have the people who maybe would have been selling foodstuffs and all that. We also have the people who want to witness these celebrations firsthand. So all these people are disappointed, but we choose to view the bigger picture in terms of there's no need of celebrating Mashujaa Day, then dying after that. We've seen it before where political rallies happen. Then the week later, the areas where these rallies were have the highest COVID infection rates. So we are disappointed, but we understand it. It's in good faith.
Finally, Dr. Mwange, equitable global access to vaccines, that was at the core, and the efforts, of course, to build back better from the pandemic was, one of the core messages of the Kenyan president at the UN General Assembly. What's the progress, especially efforts of getting more vaccines for Kenyans?
Okay, first of all, vaccinations in African countries, I think this is an issue that we all have, even in Nigeria. One, there's the issue of the vaccines not being recognized. Then there's the issue of the patents, meaning we can't make the vaccines ourselves. So when we speak about vaccine equity and getting the vaccines, we have to understand that most of it relies on diplomacy. We've seen our president going out and meeting foreign leaders, and this has actually bore fruit because these foreign leaders actually give us the vaccines. The latest one, which we saw, we had 400,000 doses of AstraZeneca from the UK, which were being given. So regarding the vaccine uptake in Kenya, I can say we are doing quite well because we've had 3.6 million vaccines given so far, 889 of them being the total second doses. So this is an approximate percentage of 32% of individuals who've actually gotten the first and the second doses. So apart from that, we also have an online self-registration platform where you can actually register. You have the date of vaccination being given to you. And it's even gone to the point of having the center of vaccination being recorded on that portal. So I think we're really trying, and I hope we continue this way.
All right, we always appreciate your time on the program. Thank you. Dr. Lucky Mwange is a general practitioner joining us from Nairobi, Kenya. Thanks again.
Thank you.
The New South Wales, home to Sydney, has announced its roadmap out of lockdown with restrictions to be eased after the vaccination rate hits 70%. However, people who aren't fully vaccinated will have to wait longer for their freedoms. This is as New Zealand is to pilot stay-at-home quarantine for travellers rather than state facilities. Here's more on the global update.
While Uganda's research proves insightful into efficacy of the vaccines, Zimbabwe has received the fourth batch of Sinopharm COVID-19 vaccine doses from China. The Chinese ambassador to Zimbabwe, Guo Xiaoshun, handed over the consignment to Vice President Constantino Chiwenga, who's also the country's Minister of Health and Child Care. At Harare's Robert Mugabe International Airport, Chiwenga expressed his gratitude to China for supporting Zimbabwe's fight against COVID-19. Meanwhile, China's mainland has administered over 2.2 billion doses of COVID-19 vaccines, according to data released by the National Health Commission. The capital, Beijing, administered over 40 million doses as of Sunday, with over 1.3 million given to people aged 12 to 17. The mainland reported 13 new local cases, according to the National Health Commission. Australia's New South Wales government has unveiled a roadmap for reopening the state from COVID-19 shutdowns, detailing the differing levels of freedom to be afforded to citizens based on their vaccination status. The Premier says life will feel like it is getting back to normal when the 70% double vaccination rate is met, and when the figure hits 80%, community sports, regional travel and other activities will be able to resume. Finally, the cumulative total of confirmed COVID-19 cases in the United States topped 42.9 million as of Sunday, with the death toll surpassing 678,000. The country's case count rose over 42 million and the death toll 687,985. The U.S. continues to lead the world in the number of confirmed COVID-19 cases and deaths.
It's important to limit the risk of COVID-19 infection among all ages. For children returning to school, this is the time to remind them to recognize and adhere to the protocols in schools. You can find more updates of the pandemic on our websites. There are also breaking news on the site and more about the COVID-19 virus, all at your fingertips. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.